Hello and welcome. Today, we're diving into the complexities of renal papillary necrosis, a condition that affects the kidneys and can have significant consequences for overall health. Join us as we explore its causes, symptoms, diagnosis, and management. Renal papillary necrosis, or RPN, occurs when the renal papillae, which are the tips of the renal pyramids in the kidney, die. The most common cause of RPN is analgesic nephropathy, meaning long-term overuse of pain medications, especially combinations containing aspirin, acetaminophen, and caffeine or codeine. Other major causes include diabetes mellitus, particularly when poorly controlled, sickle cell disease or trait, urinary tract obstruction, pyelonephritis, and renal transplant rejection. Less common causes involve chronic alcoholism and certain vasculitides. The pathophysiology of RPN involves ischemia, or lack of blood supply to the renal papillae. In analgesic nephropathy, for example, certain pain medications directly damage the blood vessels supplying the papillae. Diabetes leads to microvascular disease, which also reduces blood flow. Sickle cell disease causes sickled red blood cells to obstruct small vessels. Regardless of the cause, the lack of oxygen and nutrients results in cellular death, leading to necrosis. The dead tissue can then slough off, causing further complications within the urinary system. Estimating the precise epidemiology of renal papillary necrosis is challenging due to its frequent association with underlying conditions and the potential for misdiagnosis. However, analgesic nephropathy, historically a significant contributor, has decreased with restrictions on certain pain medications. Diabetes and sickle cell disease remain important risk factors, impacting populations based on their prevalence of these conditions. The occurrence of RPN post-renal transplant is a serious, but relatively less common complication. The signs and symptoms of renal papillary necrosis can vary depending on the severity and underlying cause. Some individuals may be asymptomatic in the early stages. However, as the condition progresses, common symptoms include flank pain, hematuria of blood in the urine, dysuria, painful urination, and frequent urinary tract infections. In severe cases, acute kidney injury can develop, leading to decreased urine output, swelling, and electrolyte imbalances. Symptoms related to the underlying cause, such as diabetic complications or sickle cell crises, may also be present. Diagnosing renal papillary necrosis typically involves a combination of clinical evaluation and imaging studies. A thorough medical history, including medication use and presence of underlying conditions, is crucial. Urinalysis can reveal hematuria and pruritus, white blood cells in the urine. Imaging studies such as intravenous pyelogram (IVP) or CT urography can visualize the characteristic ring shadow or medullary cavitation appearance of the necrotic papillae. Retrograde pyelography may also be used, although less frequently now due to the availability of less invasive options. Renal biopsy is rarely performed but may be considered in atypical cases. While renal papillary necrosis isn't typically classified into distinct types, it can be described based on the extent and location of papillary involvement, and more importantly, the underlying cause. For example, we can differentiate between RPN secondary to analgesic nephropathy versus RPN secondary to sickle cell disease. Understanding the etiology is critical for guiding treatment strategies. The treatment of renal papillary necrosis focuses on addressing the underlying cause, managing symptoms, and preventing further kidney damage. If analgesic nephropathy is the culprit, immediate cessation of the offending medications is essential. For diabetic patients, strict glycemic control is paramount. Treatment of urinary tract infections with appropriate antibiotics is necessary. In some cases, surgery may be required to remove obstructing tissue. Hemodialysis or peritoneal dialysis may be needed to manage acute kidney injury. Supportive care includes pain management and maintaining adequate hydration. Prevention of renal papillary necrosis centers around avoiding the known risk factors. Judicious use of pain medications with close monitoring by a healthcare professional is crucial. Individuals with diabetes should adhere to strict blood sugar control. Genetic counseling may be beneficial for families with sickle cell disease. Prompt diagnosis and treatment of urinary tract infections are also important. Regular kidney function monitoring is recommended for individuals at high risk. The prognosis for renal papillary necrosis depends largely on the severity of the condition, the underlying cause, and the promptness of treatment. Early diagnosis and intervention can help preserve kidney function and prevent progression to end-stage renal disease. Recent research focuses on developing more sensitive imaging techniques for early detection and exploring potential therapeutic targets to prevent papillary damage. Studies are also investigating the long-term effects of RPN on cardiovascular health and overall mortality. The continued advancements in understanding the disease processes and the underlying conditions associated with it will lead to the development of better preventive and therapeutic options.